So when we think about any type of expressive arts therapy, whether it's play therapy or dance or movement or uh, art or sculpture, there's a lot of different people who were kind of founding figures in expressive arts therapy. And now each one of those types of art has branched off to be its own type of therapy, like art therapy is its own branch now. Music therapy is its own branch. But when all this got started, they were really exploring all of the arts and kind of being creative in how to use these things therapeutically. And one of the most influential books was by Carl Rogers' daughter, uh, Natalie Rogers. So, of course, she had been brought up by uh, her parents and Carl Rogers, and you know, so, but she was a little more creative and into the arts, and whereas Carl Rogers was somewhat reserved, but she took everything that her father developed. And of course, he wrote a book called On Becoming a Person. And, but everything from congruence and genuineness, unconditional positive regard, and acceptance of others for who they are, accurate empathic understanding, all of the techniques that you learn in our skills class, like reflection and paraphrase, summarization, clarification, pointing out some incongruencies possibly. And uh, and I think the third thing is really that there's two types of therapy, no matter what type of expressive arts therapy you use. One is totally non-directive, and one is directive. So most therapists don't really understand non-directive therapy. They're so used to saying, oh, let's paint a picture of your family. But that's totally directive. Um, you know, both Natalie and Carl Rogers leaned on the side of being non-directive. And this is a very difficult thing to learn and practice. So being non-directive is basically giving whoever you're working with options. And once they choose one, they can do whatever they want. And not even asking questions like, what's that a picture of? You know, but so if you do say something, it really is just a continuation of those basic person-centered techniques of reflection. Oh, you're using red now. I see you're playing in the sandbox. So you could make a longer reflection, which is like a paragraph, and it could be a paraphrase. But one of the things that this does is that so many times I've worked with clients who basically had lost trust in others because they had been mistreated in some way, because they had been abused in some way, or rejected, or betrayed. And so because they lost this trust in others, they would not allow themselves to become vulnerable in the presence of other. And they were always guarded. However, so it was very difficult for them to find a safe place or space in the presence of another person, especially if it's somebody they didn't know, like a therapist. So, you know, fortunately, I never had any time limits on therapy. Um, and if I contracted with CYS or, with families or whatever it might be, I told them if it was an issue of abuse or mistreatment, um, that this may take a long time. So, you know, I I did have an office, and then you'd go through a door, and I had kind of an expressive arts room, called it a playroom, but it had everything from a play area, which included a sand table, but it also had an art area. It had a table, it had an easel, it had all kinds of art supplies, um, back then it had a cassette player if somebody wanted to bring in a song that meant something to them. Uh, we could listen to it together and they could share with me whatever they wanted. Um, so it had a lot of different things. It wasn't just a playroom. Um, a lot of times, if I got teenagers uh, who were somewhat, I call them rebellious. They all had diagnoses, but you know, um, a lot of times if they didn't want to talk in the counseling room, I never forced them, but I would just one week they would come in and I'd say, "Oh, I can't use that office today. Would you mind? I know it's inconvenient. Would you mind coming into the playroom while we talk? And you could do anything you want while we talk so you're not bored." And I just sat on the floor and let them do whatever they wanted to do. And eventually they're doing something. They're either creating something with the art stuff, or they're sitting by the sand table, running their hands through the sand, and eventually, you know, doing some other things. They might be holding one of the stuffed animals, but they are beginning to interact with the environment. And it's a much safer environment. They're just not sitting with some adult talking to them, because 99% of the time when they're in a room with an adult, they're either getting lectured or punished or something like that for something that they did wrong. So that simple change of environment removes any type of authoritarian expectations and gives them more freedom to be themselves. Just to give you an idea of some of the specific things I would have in that room. So some type of nurturing family toys that included dolls, baby bottles, blankets, diapers, doll houses, furniture, doll families, puppets, puppet families, people and animals, uh, miniatures, like everything from like army soldiers to emergency people like doctors, police, fire, rescue, ambulances, a kitchen set with food, play food and dishes, a doctor's kit. Um, I would have some fantasy or pretend toys, like all kinds of dress up clothes, hats, costume jewelry, um, play money, magic wands, uh, all kinds of vehicles, um, communication toys like play phones, microphones, mailboxes. I can't tell you how many times a child didn't want to talk to me, but if they handed me the phone, I would answer it and we would have an entire conversation. Um, and I guess back then I had the phones that had the wires on them. Now we have probably play cell phones. And for the more artistic stuff, art supplies like markers, crayons, paints, paper. I always, if I bring one thing, it's always crayons. I know people like what would be considered better art supplies, but the reason I use crayons is because people don't have to be perfect with crayons. If you're coloring one of those mandalas, you may want a very sharp colored pencil, but that's your own perfectionism. It may be hard to stay in the lines with the crayons. And, you know, uh, using crayons brings us back to an earlier period of our lives, good or bad. But, um, we don't have to be so perfect. I'll tell you, always use your counseling skills for good. Uh, so, but I'll tell you a story of one time I did something I probably shouldn't have. It's not that bad. But my kid was getting bullied in kindergarten. And, um, you know, every time my daughter they would color something in kindergarten, and the other child who sat next to her would criticize her artwork because she wasn't staying in the lines, and she wasn't coloring things the color they were supposed to be, like flowers. She might color them a color the flower wasn't supposed to be. But we always taught them, well, you don't have to be perfect. You could color things creatively, you know. And so we went through like two different appropriate responses, and the kid just got meaner and meaner. and the third time, I told my child, next time they criticize you for not coloring in the lines, just say, well, does your mommy still love you if you don't color in the lines? And that kind of solved the problem, but it was not a good thing to do. So, but hey, bullying, what the heck? I think it got to the root of the issue. Conditional love versus unconditional positive regard and acceptance. And then I felt really bad. So then I told my kid next time it happened that, my kid told her, I like you whether you color in the lines or not. So I thought that might have made up for it because I felt bad. It helped my own conscience a little bit. So, crayons, and cardboard bricks or boxes, a big cardboard box, building blocks, Legos, all kinds of anything you can think of, and think about acting for kids, what would they like to act out? Monsters, villains, heroes, plastic soldiers, dinosaurs, spiders, snakes, aggressive looking puppets, dragons, animals. So there are some other things that I included that may not seem so nice. I had one toy gun. I had one plastic pair of handcuffs. And you might think, well, why are you putting these violent things in the playroom? Well, so many times they would act out how friends or family were arrested, or one child was held hostage and had a gun to her head. Um, and all of these things were acted out in the playroom. So I usually include some of those things that somebody might not think is a great toy to have in a therapeutic playroom. But a lot of children experience some severe violence. Um, and you know, I think one of the one of the most important things, even though it's messy and it takes up a lot of space, is a sand table. There's something archetypal about running your fingers through sand. It's comforting. It's if somebody doesn't know what to do, they can play with the sand. But um, it's often very therapeutic as well because it's a very simple thing. And not a lot of kids today have sandboxes like they used to. And but it was especially pertinent over the last 10, 15 years because they knew that if a parent was deployed in Iraq or Afghanistan, that that's a place that had a lot of sand. And it was kind of a natural play area for them to talk about their concerns about a loved one who was, overseas. And they could express their worries and act them out. Um, and once again, in that playroom, in that expressive arts room, um, it was always non-directive. And I really had to ask myself what the therapeutic value would be if I wanted to give a directive activity to a child. It had to be of real therapeutic value for me to be directive with them. Of course, being non-directive takes a lot more time, but the trust and safety that is built is much stronger. Um, the times that I would normally give a directive activity were normally with teenagers. And if they had a conversation with me about music, something they were listening to, I'd give them an activity like, well, would you mind just picking out a few tapes of music that you not only like, but maybe the lyrics mean something to you and you listen to it and you can relate to it. And if you bring it in, we'll sit around and listen to it. And that's a fairly non-threatening therapy session, sitting around listening to music. But it was usually something that was quite therapeutic because they would usually pick some very meaningful songs to them. So I think that puppets, we talked a little bit about puppets, but when we think about puppets, you know, puppets can have a lot of depth because one of the puppets can be the client, but it could be almost like that Gestalt thing with the mask. Is this puppet the person you want the world to see? Or is this puppet the real you? Is the other puppet, is it, somebody they feel safe with, somebody that they fear? Are they going to act out a trauma or a crisis or, something like that? So a lot of times they would act out somebody who died because that person's no longer there, but I could be that other person as a puppet. And we could process the loss and the grief. And, so I think that a lot of people, when they think about art therapy, they focus on things like colors. I know a lot of kids whose favorite color is like black. Oh, look, she colored that whole piece of paper black. There must be some deep-seated issues. No, it could be their favorite color. So I don't assume anything. I don't interpret anything. If they draw a monster on a piece of paper, it could be a horror television show that they watched. But most of the therapeutic techniques are still person-centered. So when we do therapy, I really want the person to try to experience a feeling that is linked with a thought. So I'm hoping that their art expresses feelings as well as facts. I think that if they allow a feeling to flow into the art, which is kind of a natural thing, I think one of the problems with kids who have experienced some kind of trauma, if they are guarded, they're always cognitive. They're on guard. They don't allow themselves to be in the present moment. But art allows for a sense of flow, and they can become immersed in the artistic experience, whatever that might be. And it brings them into the present moment rather than remaining kind of cognitively. I think I'm going to have another time we're going to talk about narrative therapy, but I always included, and I'm going to post them so you can have them as well, but I always included like pieces of paper with all different sizes of squares, so that if we were doing narrative therapy, they could draw their own comic book instead of like writing out a story or making like a professional book. Maybe they like comics, maybe they like Marvel comics or DC comics or whatever, but they could make their own comic book in narrative therapy. We'll talk about how to do that. The one thing I haven't done a lot with, but my wife has, is yoga, dance, and, movement. But she's, my wife is like a certified yoga teacher and Reiki and drum circles, and, I'll just watch the kids. So, yeah. But let's see what else. Music therapy. I think one of the best ways to really get to know a person, or know about a person, is to look at their playlist. And you'll learn more about an individual by looking at their playlist on their phone than anything else. So a lot of times when a teen or a young person didn't really connect with me therapeutically, sometimes we could connect through music. So like I had this one teenage client, and, she was a big Nirvana fan, but this was more recent. So Kurt Cobain was deceased, but she would always say things like, "You're an old man. You wouldn't know about, my music, or, what I'm interested in." And and she happened to be wearing like a Kurt Cobain t-shirt, like a concert t-shirt. And I said, "Well, obviously you like this guy and you like his music. Do you know when he was born?" And she's like, "No." And I said, "He was born in 1967. And I pulled out my driver's license and gave it to her, and it was the same year. So you never know what's going to connect you with somebody. Um, but I'd be like, he'd be an old man now too. But so I think that a lot of times um there are like very specific things you can do with music therapy, and all of these things have certifications now. But that doesn't mean you can't use these things creatively as a therapist. I'm not going to advertise myself as a music therapist. It doesn't mean I can't listen to music with my client. I'm not going to advertise myself as an art therapist, but hey, they can still draw a comic book with me. So I think it's all about, you know, um, if you really are into one of these venues or methods, you can get, you know, certified or licensed in that area, especially if you have like school or clinical mental health master's degree. A lot of the courses are the same. You just have to have that specialization. Um, I think there's a universality with expressive arts. There's a universality in music. Not everybody likes the same music, but 9 times out of 10, somebody's going to like music. Um, I think these things are archetypal and they transcend culture, and all of these things recur throughout the world and history. So these are things that everybody can relate to and are drawn to naturally. Um, I think that uh, with the advent of neuroscience, we're learning more about, you know, the effects of mindfulness and music and everything else. And I think right now is a time period where they're becoming more valid as therapeutic tools and recognized. Um, I think a lot of these expressive arts engage more than one sense, and that brings out more emotions, memories, cognitions, because it's more immersive, and um, it can bring about not only more memories, but more related emotions. Um, let's see. Yeah, that's just kind of like an overview of expressive arts. Um, Next time we're going to focus on two different activities for the second half, and we'll do that each night after we have the lecture on the book and the topic. Anybody want to share anything or comment or ask anything?
Well, all I can say about all of that is that just being an artist and being in the crafts for a long time was my only salvation, because we moved around so much in the military, and that's the only friend I could bring with me. So drawing and journaling and all of that stuff was an important part of my life. So I know how important it is to, even if you're not good or something doesn't turn out the way you want it to be, it's still a reflection and it's still an expression that's healthy and healing, and it keeps me sane.
Yeah, yeah, it does. And I think like there's this book I read to every one of my kids at a certain age, and it's called something about like the spot, the mistake or something like that. But the book, somebody spills some ink on a piece of paper, and you know it's all about not having to be perfect. Like you could take that mistake and make something really creative out of it. uh it doesn't have to be ruined. You can still make something pretty interesting. It just may not be what you planned from the beginning. um so yeah.
That's a great book. I'll have to look that up.
Yeah, I forget the exact name, but something about Spot. But what else? All right, get those suicide assessment projects completed. And there's no discussion board this week, so you should have plenty of time. I'll see you next week.